goals and objectives to advance the Commission's vision of well-being for all Californians. Cody, at this time, I would ask you to please bring up the strategic goal slide. Thank you, Cody. At this time, we will be taking roll to establish a quorum. Mariani, could you please take roll?
Yes. Commissioner Bontrager? Commissioner Boyd? Commissioner Brown? Commissioner Bunch?
Present.
Commissioner Carnevale?
Here.
Commissioner Carrillo? Commissioner Chambers?
Present.
Commissioner Chen?
Present.
Commissioner Cortese? Commissioner Danovich?
Here.
Commissioner Gordon? Commissioner Mitchell?
Present.
Commissioner Roulette? Commissioner Tamplin?
Here.
Vice Chair Alvarez?
Here.
And Chair Madrigal-Weiss.
Here.
Okay, we have a quorum.
Thank you, Mariani. We're now going to move on to agenda item number 2. At this time, I'd like to make a few announcements. The July 2022 Commission meeting recording is now available on our website. And the next Commission meeting will take place on September 22nd in Sacramento. And I want to share some bittersweet news today. After 16 years working at the Commission, Matt Lieberman will be retiring from state service effective at the end of the month. Matt is the longest serving staff member at the Commission. During his tenure, Matt worked on several projects, including the Co-Occurring Disorders Committee, where he was the lead staff member. Matt also served as the interim head of communications, and he also produced many legislative reports on the MHSA program implementation. Most recently, he has served as the Commission's liaison to the California Behavioral Health Boards and Commissions. He helped launch the first and second rounds of funding to support Senate Bill 82 triage programs, and he served as a lead staff member on the Commission's Client and Family Leadership Committee. Matt, on behalf of the Commission, I want to say thank you and congratulations on all your excellent work during the last 16 years. We will miss your contributions as staff historian and as a person who has always kept a sharp focus on the consumer family member perspective. I hope you enjoy all those things you will now have time for that I'm told you enjoy, like gardening, reading, and spending time with your family during your well-deserved retirement. Matt, I invite you to say a few words if you would like to now.
Sure. Thank you, Chair Madrigal-Weiss. It's been a great experience being at the Commission all these years, starting off with a staff of 4 people and growing to over 50, and being in 4 different offices and 4 different executive directors. So it's been a lot of experience, a lot of changes, and all for the good. And we really appreciate moving to your leadership and the leadership of Executive Director Ewing. I think the Commission is on a great track for the future.
Thank you so much, Matt. We wish you all the best, and thanks for sharing with, I learned more. I didn't realize there was 4 executive directors already, and 16 years, I've been here 5 now. So we appreciate you and everything you've done for us. And if there's any commissioners that would like to say anything to Matt, wishing him well, please, Commissioner Kaplan.
Yay, thank you, Chair Madrigal-Weiss. And I just want to echo the appreciation for Matt. He's always been supportive in every project and committee that he's worked on. Matt, I've appreciated you from being when I joined as commissioner, but also when I was a committee member, and you have been consistent with everybody, no matter what role, whether it's our advocates, our stakeholders, our commissioners and other team members. You've really been kind, welcoming, and supportive in every project we've worked on. And I will miss you. And I look forward to seeing you tomorrow. So,
Okay, thank you so much.
thank you.
Thank you, Matt. Take good care.
Okay,
At this time, also, I'm really excited to announce that the Commission, in conjunction with PBS, KVIE, and Community Mental Health Partners, will be hosting a special screening and panel discussion of Ken Burns' recent documentary, Hiding in Plain Sight, Youth Mental Illness. It will be on September 22nd at 5:30 p.m. at the Sophia Theater in Sacramento, California. This is the same day as our next commission meeting, also in Sacramento. So I hope that you will be able to stay, experience a 30-minute screening of the film, followed by a panel discussion with representatives of the film, including director Christopher Ewers and youth film subject Morgan Brennan, as they discuss the crisis live on stage. Further details are available on the Commission's website. And at this time, I would like to invite fellow commissioners to provide committee updates. We will hear from the Cultural and Linguistic Competency Committee, Client and Family Leadership Committee, and the Research and Evaluation Committee. So I would like to invite Vice Chair Alvarez and Commissioners Tamplin and Danovich to provide their updates.
Thank you, Chair Madrigal-Weiss. Hi, everybody. Myra Alvarez, I'm the chair of the Cultural and Linguistic Competency Committee. We just met on Tuesday of this week. Due to vacations and summer schedules, we had to reschedule a couple of times. So really appreciate people's patience with that. As part of our equity and action component of our agenda, we heard a presentation from the Commission's LGBTQ Advocacy Contractor. That's the California LGBTQ Health and Human Services Network. And that presentation was provided by Danny Cesena, who is the network's new director, and Mandy Taylor, their behavioral health manager. The conversation raised issues around their strategies to address the mental health and wellness needs of the LGBTQ community. It also spoke to their collaboration with several other organizations, especially those representing other marginalized communities across the state, to advocate for policies that advance the health and mental health of the LGBTQ communities, and really spoke to the importance of expanding access to gender-affirming healthcare and the need to identify funding to help sustain local LGBTQ organizations that focus on health and mental health. It was a rich, informative discussion, and I think what many of us talked about was how it spoke to the expansive definition that mental health must encompass in order to advance equity. One example that came up was the fact that access to gender-affirming care is mental health care. It's a recognition of and respect for one's identity, and it's critical to supporting the overall well-being of members of our trans community. The committee looks forward to hearing from other organizations that are doing excellent work to address inequities in our mental health system and are always open for suggestions for that. The committee also heard a presentation from our own commission staff, from Tom Orrock and Lester Robancho, on the outreach efforts underway to hear from transition age youth, particularly ahead of the next request for proposal for organizations seeking funding to advocate on behalf of TAY. There's 2 listening sessions that have taken place in addition to the CLCC presentation, and staff are going to be in Stockton this week to conduct a focus group to hear more about the advocacy needs of transition age youth. The committee was able to provide just helpful input around the desired characteristics of an advocacy organization which serves TAY, but also discuss the need for a statewide organization to work with a coalition of local level TAY organizations, again, to ensure that that local perspective is front and center when it comes to statewide advocacy. The next meeting of the CLCC is just around the corner. It's on September 8th from 3 to 5 p.m. And we're going to be hearing a presentation from the California Pan-Ethnic Health Network on their upcoming event entitled The Right to Heal. The Right to Heal will take place on September 20th, and it's a gathering of community members from Black, Indigenous, and communities of color to talk about mental health and wellness. The commission, as many of us know, but just to reiterate, supports this work through their Diverse Racial and Ethnic Communities Advocacy Grant. And given its alignment with the CLCC goals and purpose, these discussions offer the committee valuable input from community partners to inform our own work in the future. So thanks so much. Looking forward to seeing folks on the 8th.
Thank you so much, Vice Chair Alvarez. Really appreciate that. And just everything that we're learning from those presentations. And I appreciate that we're sharing those minutes too with our commissioners so that we're not just hearing it here, but really thinking about that and being able to inquire further. So thank you. Commissioner Templin.
Thank you, Chair Madrigal-Weiss. The Client and Family Leadership Committee will be, well, myself and Commissioner Chambers, who's Vice Chair of the CFLC, will be meeting with Commission staff, Tom Orrick, tomorrow to discuss our upcoming meeting dates. So we're meeting to schedule those for the rest of 2022, and we've had a couple months break since the summer and vacations. So we're looking forward to getting a date scheduled for September. And our committee will continue to work on the creation of a peer support specialist certification resource guide. In addition to other areas that the committee members feel are a priority for client and family members. We look forward to sharing the updates and appreciate this opportunity to give that.
Thank you, Commissioner Templin. Can I ask, will those meetings, will they be monthly, or what is the schedule, or what do you predict the schedule to be, or what has it been, I guess?
It's been every other month, and we do have a goal to complete the resource guide by December. So based on where we're at, we'll determine if it's monthly and give that update soon.
Thank you so much.
Yes.
Commissioner Danovich.
Hello. I don't have a formal update. We are in transition, and I will work with staff on actually developing a formal update that I could share, on these calls, which you all are entitled to. We did have our most recent meeting, I think August 17th, and the agenda for that meeting was first a presentation of the research and evaluation portfolio that was presented by Melissa Martin-Mollard, the chief of that, or the director of that division, the Research and Evaluation Division. And we also heard presentations from evaluators of the triage grant program, with a particular focus on the impact of that program on crisis services and services for youth. And we heard both some of the aspirations of the evaluative projects and the limitations of those projects in terms of their capacity to answer the questions that are most impactful and important. And so we are going to be working on figuring out how we develop, promote, enable evaluative strategies that are more relevant to our stakeholders and to the commission. And it's lots of work to do in that domain.
Thank you, Commissioner Danovich. At this time, I would like to provide a brief update on the PEI Subcommittee. The PEI Subcommittee released the first draft of its project report yesterday, August 24th. The draft report can be found on the Commission's website under the PEI initiative, and it has also been distributed through our listserv. There are several ways for the public to provide comment on the draft report. Written comments can be mailed to the Commission's headquarters or emailed to reportcomment@mhsoac.ca.gov. Verbal comments will be shared by the subcommittee during hybrid meetings on September 7th and October 6th. Please visit www.mhsoac.ca.gov for more information, details, and locations. Do any commissioners have any additional announcements that they would like to make at this time? Okay. Seeing none, again, I welcome everyone to today's meeting. Commissioners, if you leave the teleconference meeting for any reason and decide to rejoin, Please make sure to use the raise hand function so that the commission staff can make you a co-host again. If you have a comment to provide, please unmute your line and seek recognition when it is convenient. It is now time for agenda item number 3, general public comment. This time is reserved for comments on items that are not on the agenda. If anyone is interested in making public comment regarding the announcements or other items, please make those during this public general comment time. If you have any technical questions, please contact us at 916-500-0577. At this time, I will ask Amariani to go over the public comment procedures.
All members of the public will have the opportunity to offer comment as described in the agenda. If you would like to comment on an agenda item, please wait until that item starts. You may request to make public comment by clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. You will be placed in a queue to comment on that agenda item. When it is your turn to comment, the moderator will unmute your line and announce your name or the last 3 digits of your telephone number. When you are unmuted, we are able to hear you. We will do our best to take comments in the order they are received. Please note, once a public comment period for the agenda item starts, we will close a public comment queue, so please make requests to comment now. The moderator will insert the word last comment next to the commenter's name or number to identify the last public comment. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. When we have reached the end of your time, our staff will let you know, but we will let you finish your thoughts. We don't mean to cut you off, but we do want to help everyone keep time. We truly appreciate your understanding with this process. Lastly, if there are any members of the public using translation technology, please notify the chair, and at least twice the amount of time will be given to you during the public comment period. A live meeting transcription or closed captioning is available for anyone participating in the meeting. If that option is not currently visible, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. Chair Madrigal-Weiss, I hand it back to you.
Thank you, Amariani. Would you please open the line for general public comment?
Okay, we have 4 comments. Mandy, your line is open. You may go ahead.
Wonderful. Thank you. Good morning, all. And first, I want to say thank you to the Commission for your commitment to language accessibility and the public comments. I really appreciate that. So I wanted to share this morning with you about the California LGBTQ Health and Human Services convening that is happening next Tuesday. It is free and it is virtual, and it is for LGBTQ leaders across California. You can find out more information on all of our social medias are at California LGBTQ Health to sign up. Also wanted to share that as a part of that event, we are having a pre-conference specifically just for our Out for Mental Health partners. We will have 40 representatives from 15 task forces across California at the pre-conference. The agenda is something that's been co-created with our partners. And one of the things that they asked from us was to have a collaborative conversation with decision makers to learn more about the grievance process that advocates can use for their departments or commissions if their county's behavioral health department is not executing programs in a way that was promised to the public and or not following current California codes or policies. Oftentimes when things like this happen, folks in the local communities feel really powerless in knowing who to go to. There's often really clear ombudsman processes for individuals, but very rarely is that process as clear for when it is a community-wide issue or problem with the way the specialty mental health plan is being implemented in the county. So we've invited representatives from the DHCS, the MHS-OAC, the Behavioral Health Planning Council, and OHE to attend. We do have some confirmations. We're hoping to hear back from Executive Director Ewing soon on whether or not he'll be able to attend, or if somebody else from his department, from the commission, is a better fit for that conversation. But we're definitely hoping to have the MHS-OAC also represented in that conversation, because I know you all have such a stress the importance of that relationship with counties and community engagement plans, particularly with the programs that you all oversee. So thank you very much for your time this morning.
Thank
Oh, I'm
you,
so
Mandy.
sorry. I didn't introduce myself. Mandy Taylor, she, her, hers pronouns, from the California LGBTQ Health and Human Services Network, and I'm the Behavioral Health Equity Manager there. Thank you.
Thank you, Mandy.
Next, we have Teresa. Your line is open. You may go ahead.
Hi, this is Teresa Comstock. I'm the Executive Director for California Association of Local Behavioral Health Boards and Commissions. I want to congratulate Matt Lieberman on his retirement and thank him very much for his good work. He was the contract administrator for CalBHBC and helped us improve and sustain our service to California's 59 local mental and behavioral health boards and commissions and the communities that they serve. So thank you, Matt. I will miss you and hope you enjoy your retirement.
Thank you, Teresa.
Next, we have Steve. Your line is open. You may go ahead.
Hi, my name is Steve Dilley, the Executive Director of the Veterans Art Project. We are a funded stakeholder advocacy for Mental Health Services Oversight Accountability Commission. We're currently doing veterans mental health and wellness through pop-up art cafes. We will be having our statewide event on the west steps of the state capitol on October 12th between 10 and 4 p.m. I'd also have 3 other members of the Vet Art executive travel team as we do the planning for our statewide event. And we would like to have them all make a public comment. And I'm going to step off. We'll have the next person come on. Thank you very much.
Hi, everyone, and thank you for giving me this opportunity. My name is Darren DeVillis, and in a nutshell, 2008, I was a homeless veteran holding a sign. I was running from the authorities. I was running from a major serious drug addiction. I had been living with undiagnosed PTSD for 30 years. And when the VA gave me my diagnosis, the first treatment plan they wanted to offer me was a regimen of pills, the proverbial shoebox full of medications, and then other medications to beat the side effects of those medications. And I talked to my therapist, and the VA and my therapist used terms like chronic. I am 100% disabled with PTSD. But they came up with an idea to try a new innovative healing modality called the arts in all its many forms. I practiced with crayons, paint, ceramics, woodworking, and storytelling. And through that process, I began to open up and tell my story. I now, since I'm limited on time, I just want to tell you all I have 15 years of sobriety now. I went back to school. I am now an adjunct communication professor at 4 different colleges in San Diego County. But most importantly, I am the master of ceremonies for these pop-up art cafes. And my networking system has exploded exponentially through the 10 different California counties that we've been to. And I can't wait to be here in person in October. But ladies and gentlemen, we have 53 counties in the state of California. And what I would like as part of my healing regimen is to let my network system expand, because that's where my level of treatment has taken me. The more I get my story out, the more veterans I help, that's where I'm at. So I'll ask you please to continue funding Vet Art for these pop-up art innovative programs. Thank you.
Thank you, Steve, and congratulations, Darren. Thank you.
Next, we have
Oh,
Stacy.
hello.
Oops. Sorry.
I think, are we good?
Chair Madrigal Weiss, this was one public comment presented, but there are several speakers. I don't know if you want to treat this as one public comment with 3 minutes, or would you like to provide time for each of these speakers under one public comment?
So I think because It's different speakers. So let's go ahead and do that. They're using one device. I think that's just we'll go ahead and listen to
Okay.
the speakers, please. Go
Okay.
ahead,
So
sir.
I just
Okay.
want to introduce myself. My name is Ivan Sam. I am the Native American Tribal Veterans Ambassador for VetArt. And I do the speaking engagements as well as the land acknowledgement, sharing, knowledge about Indigenous people and the veterans within our communities that have served in the military, and also workshops, suicide prevention workshops that allows us to use these services to help veterans cope with PTSD and other traumatic brain injury situations or depression as a prevention tool. Some of these events and activities consist of like medicine bag making, doing arts and craft, using art as a healing modality. We also do a speaking engagement at the end of the sessions for each artist to speak on behalf of the work, because some of these artists have never really spoken about their struggles with PTSD or depression or their military experiences. So we try to allow them to express themselves through the arts and also to share their stories during these speaking engagements. Some of these veterans have never really opened up to the community. So this is like their opportunity to express themselves in a comfortable position where like-minded people are around them. So this allows them to continue to grow and also to heal at the same time, to be amongst camaraderie and also other people in support of their healing. So with that in mind, I just want to say thank you all for allowing us to speak, and continue to support us at VetArt as we do this statewide event coming up. Thank you.
Thank you, Evan.
You got one more speaker here?
Hello, I'm Bill DeVillis, Darren's young brother. I do the logistics part for VetArt pop-ups. I've witnessed Darren firsthand hitting rock bottom and building himself back up through VetArt. It's really helping him out a lot. His life has been really tough, not to mention mine also, but he's the veteran and it's all about curing him. I'm really proud of him, how he's changed his life around, and it's all about VetArt. And that's all I gotta say. Thank you.
Thank you, Bill.
Next, we have Stacy. Your line is open. You may go ahead.
There's Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. I would like to also thank Matt Lieberman for his many years of service. He's always been professional, and we really wish you well, Matt. Thank you again for all your assistance and your grace. I'd also like to welcome the commissioners, or ask them to save the date, October 14th, which is a Friday, in Los Angeles. There will be a mega event for the California Reducing Disparities Project that will center on the evaluation. So Commissioner Danovich, I know because you're with research and evaluation, but really all the commissioners, this is such a great opportunity to find out that there is research that proves that these community-defined evidence practices work, and it would just be so interesting. So I hope you save Friday, October 14th. The other subject I wish to cover as my time remains is the commission was asked last month to take positions on some bills that impacted the MHSA. SB 1338, the Care Court Bill, and AB 2242, Santiago, which would allow use of MHSA funds for persons on involuntary holds, something that the MHSA funds were never supposed to do. Another bill has been amended at the last minute in the legislature, SB 1302, which would direct the state controller to distribute funds to the superintendent of public instruction to provide grants to certain local educational agencies to improve or establish health centers that provide comprehensive medical and behavioral and mental health services. While this is a noble and acceptable purpose for the funds, this violates the established process of having counties in collaboration with local stakeholders make these spending decisions. This is not supported by statewide stakeholders involved with and knowledgeable about the MHSA. Next year, RUMCO once more urges the commission to establish a legislative committee to thoroughly review in a comprehensive manner all the bills that involve or affect the MHSA. Principles could be developed to guide the commission in taking positions on bills in an organized, transparent, and in a way that upholds the long-held values and provisions of the MHSA. Thank you.
Thank you, Stacy.
Next, we have Tanya. Your line is open. You may go ahead.
Good morning. My name is Tanya Civis, and I've had the pleasure of being involved with Vet Art just before COVID started. Unfortunately, when COVID started, we no longer could go to the studio. But with the Veterans Art Project, we were able to continue to get supplies that we needed to get involved with the arts. And I had the privilege of getting involved with the pop-up cafes. I can't tell you how tremendously that has helped to save my mental wellness. I'm a two-time suicide survivor. And just getting involved in ceramics and the arts and the pop-up cafes has helped me with my balancing my anxiety, my military sexual trauma, my PTSD. And as time has gone by, I was able to encourage other women to get involved. Unfortunately, it's hard in the VA system to get the help we need because of the shortage of physicians or facilities for us to go to. So being able to have something to help ease our mind and anxiety besides drugs, because I was also hooked on drugs to help with my chronic pain that I go through, but just to be able to get involved with the arts to help with my mental wellness. You know, we talk about our physical wellness, we talk about financial wellness, but it's like a hush hush to talk about mental wellness. It's so important, not with just the veteran community, but I'm very thankful for Steve Dilly and the Veterans Art Project for starting Vet Art to give us a place to go, another resource besides going to the medications or going to the alcohol. So like I said, I'm very blessed and privileged to have been involved in these pop-up cafes and introducing other women to the pop-up cafes. Now I'm the director of advocacy at the Veterans Art Project. And my goal is continue to reach out to the VA to let them know that art is really needed and is a modality to mental wellness and to mental health for the veteran community. And I just want to thank Masak for allowing Vet Art to get involved with these pop-ups and hope that in the future this can be a regular thing for us so we can continue on our journey of healing, not to just have a life of just existing, but have a life of living. Thank you for allowing me to share.
Thank you, Tanya.
Angela, your line is open. You may go ahead.
Good morning, everyone. My name is Angela Brand. My pronouns are she, her. I just wanted to congratulate Matt on his retirement. Just echoing Commissioner Tamplin's remarks. I've worked with Matt for a really long time, and he has always been such a consistent and welcoming force with the commission. And so before I joined the commission, when I was engaging with the committees, Matt was always super approachable, really knowledgeable, carried a lot of historical knowledge about the commission. And, you know, as he said, coming from 4 to over 50 employees, has really been just a staple in terms of folks representing the work that the commission did. So I just want to say thank you and congratulations for your retirement. And I hope that you have a great time not clocking in every day and doing all the things that you want to do with your family. So thanks, Matt.
Matt sends that wave. Thank you, Angela.
All right, and then our last comment is Anna, your line is open. You may go ahead.
Thank you. First of all, I wanted to second everything that Stacy said and remind folks that MHSA was created to promote and increase voluntary peer-run services, and the services that are created and designed by folks with direct lived experience. That was the intent of the law. I can say that because I was one of the folks who was working on creating and implementing MHSA. So I urge you to please make sure that those funds will never be spent on forced treatment. That doesn't work. The second thing I wanted to say is I wanted to urge the commission to focus on supporting and funding local peer-run programs and services. And by peer-run, I mean consumer-run, folks with direct lived experience. Unfortunately, still, very often when we get additional funding or new funding, the money does not go directly to those programs. It gets sort of spread out through the whole system in different ways. And we know that these services are very effective, especially when they're added to already existing services. They should be driving the system, not being a second thought. So, and as we're implementing SB 803, it is very important to focus on that. Thank you so much.
Thank you, Anna. I thank everybody for their comments. You know, as always, we learn from them, we take note. And I also want to apologize, I forgot my manners. As a military brat, so to speak, I want to reach out and say, Steve, Bill, Ivan, Darren, Tanya, thank you for your service. I should have said that up front. Thank you for your service. So moving on, at this time, we have come to agenda item number 4. And we would like to consider approval for the minutes from July 28. I will invite commissioners to offer comments or ask questions. Any questions or comments regarding our minutes from our last meeting of July 28, commissioners? No, seeing no questions or comments, I would ask if members of the public, if there are any comments on agenda item number 4. If so, I would ask that you raise your hand on your computer or app, or if calling in by phone, push *9. Once the public comment period for this agenda item starts, we will close the public comment queue. So please make your request to comment now. We would ask that, I don't see any. Mariani, am I seeing correctly?
Yes, there are none.
Okay.
Oh yeah, there are none.
Okay, so then seeing none, we will go ahead and move forward. Is there a motion from commissioners to approve our minutes?
So moved.
Thank you, Commissioner Carnevale.
Second.
Thank you, Commissioner Bench. Still seeing any additional questions or comments from our commissioners? We didn't have any, so I'm saying no. Then Mariani, I would ask, did we give enough time? Jeff, our counsel, we gave enough time?
Yes, Commissioner, we gave enough time.
Thank you, sir. All right, Mariani, I will ask that we take roll on the motion.
Okay. Commissioner Bontrager.
Aye.
Commissioner Boyd. Commissioner Brown. Commissioner Bunch,
Aye.
Commissioner Carnavale,
Yes.
Commissioner Carrillo, Commissioner Chambers, Commissioner Chen, Commissioner Cortese, Commissioner Danovich,
Aye.
Commissioner Gordon, Commissioner Mitchell,
Approve.
Commissioner Roulette, Commissioner Tamplin,
I'll abstain. I wasn't here last month.
Vice Chair Alvarez,
I'll abstain as well. I left after 45 minutes.
and Chair Madrigal Weiss.
Approve.
And then just going back, Commissioner Chen. Commissioner Chambers,
Yes, sorry, I stepped away for a second. Take care of my son, sorry.
okay, no worries. Was that a yes for the minutes?
And
Yes.
and that was an aye from my side. Apologies,
Okay,
I had a
great.
delay in muting.
No worries, thank you. The motion. There were,
Did we get approval from Commissioner Chambers then to approve the minutes?
yes, we
Yes.
did. So now we
Okay.
have eight yeses. And 2 abstains.
Madam Chair, the motion passes. There were 8 yes votes and 2 abstentions, and we have a quorum, and therefore the minutes have been approved.
Thank you so much. All right, moving on. Item number 5. We will now take up agenda item number 5. The Commission will consider creating a subcommittee to explore opportunities to prevent firearm violence and its impact on individual, family, and community mental health and well-being, including strategies to improve understanding of the relationship between mental health and firearm violence. So a few days before the Commission conducted its May 26th meeting, I remember this, when we came in, we had just heard about the 19 children and 2 teachers that had tragically lost their lives in the shooting at Robb Elementary in Uvalde, Texas. And a week or so prior to that, 10 people were gunned down and 3 were injured during a racially motivated mass shooting while they were shopping at Tops Friendly Market store in Buffalo, New York. In the time between now and when the Commission last convened in July 28th, there have been 34 mass shootings in the United States, according to data compiled by Gun Violence Achieve. 129 people were injured, 35 people died. As heartbreaking as the statistics are, they represent just a fraction of the total number of people who have been injured or died by firearm violence or suicide. Firearm violence and suicide takes a toll on individuals, family members, and overall the community mental health and well-being. So in response to the statements that we brought up that day, and I think, just feeling it. We were coming in from it, we're getting ready for the Commission meeting. I'm watching the news. Commissioner Bunch was, made a statement. Commissioner Bontrager did too. And, oftentimes we hear, how the media reflects it, how people in the media reflect it, that it's a mental health issue. And that's what Commissioner Bontrager responded to too, that, automatically that's the jump to. So in response to statements that we heard and interest in exploring there's an interest in exploring how the Commission could act on this issue. So I'm proposing that the Commission form a subcommittee on firearm violence prevention. More information is needed on this, including background information. And the Commission, we want to develop this subcommittee to really look into policy research and create projects. You can find more information on it in the materials for agenda item number 5. So at this time, I would like to invite commissioners to offer comments, ask questions, There is no set. This is more kind of a discovery. What are your thoughts on this? Is this something that you would be interested in? There's been, some conversations. I know Commissioner Bench and I have really talked about it. We're seeing conversations in schools. We're seeing it in our hospitals. We're seeing it in our children's hospitals. So there's conversations happening across the areas that are dealing with this. So I wanted to have this discussion, invite our commissioner, my commissioners to have this discussion. Our commissioners, us, to have a discussion. So that's what I'm inviting. Commissioner Bench, please, if you'd like to start us off.
Thank you. As you said, we had so many conversations about it. Even the day of the commission meeting, I remember going to the airport and getting on the phone and having a discussion with our clinic and how all of the clinicians were feeling about it. And then getting home and having a discussion of gun violence with my 9-year-old and 12-year-old. And throughout all of these conversations, there was this just kind of overwhelming sense of hopelessness, regardless of who I was talking to. So I'm just grateful for this idea that you're bringing to the table, because with the hope that at the very least, we can decrease some of that hopelessness that this is ever going to get better. I think just as a commission, we have to recognize that gun violence and other forms of violence, they impact mental health, they impact individuals and families. And if we can do anything around that to help focus prevention and focus solutions, then I think it's really important that we take that step. This is just too significant to ignore at this point. Thank you.
Thank you, Commissioner Bench. Commissioner Danovich.
Yeah, well, first I would just amplify all the comments you made about the enormity of the impact of gun violence and its mental health sequelae. It's just beyond. And I personally feel incredibly passionate about it. I personally donate to the cause and have 3 small kids, and it's very relevant. But I would make an argument against getting into this with respect to the commission. And the main argument is around focus. I think that we have so much on our plate, and I worry about our ability to execute on our existing portfolio of activities across what we do. I think that we already have some mandates and charges that are really broad and challenging for us, like homelessness. Homelessness is different than mental health, even though there's a lot of overlay and the two get conflated. There are structural issues around things like housing and policy in our state that contribute to homelessness. And the connection to it, which is statutorily written in our, in the act, causes the commission's activity to be maligned, because the failure to act or the worsening of the homeless crisis gets linked to the other things that the commission focuses on. And so as much as I am impassioned about gun violence, I worry that adding another domain that also gets conflated with mental health, right? Gun violence is not caused by mental health. It has mental health sequelae, but so does climate change. And I feel really impassioned about climate change. And so I worry about scope. Maybe, if we do gun violence, maybe we should also get into climate change, and we have, could have a whole host of things that have mental health sequelae. I'd like to see us keep our focus on our existing portfolio and double down in actionable areas where our interventions have a chance of actually moving the needle. And then I would welcome our co-sponsorship, partnership, working with other organizations that have the focus to be able to be impactful and effective on something as important as gun violence. But I wouldn't want to diffuse our attention.
Thank you, Commissioner Danovich. And, I'm not sure exactly what it would look like. So again, this is initial thought, and there would be some discovery, and I'd want to have more. So again, initial thoughts. So I appreciate what you're saying. Thank you so much. All that to take into consideration. Any other commissioners' thoughts on this? Please, Commissioner Carnevale.
Yeah, sorry, my raised hand I can't seem to find it.
Okay, we'll take the real one.
I agree with both of you. Like both of you, passionate about the gun violence issues. I think that, I tend to side with Commissioner Danovich because it is a broadening beyond too many things that we have. But what I'm in favor of, which is consistent with a lot of my positions, is that studying it around the category of early assessment and intervention strategies that can actually impact the long-term objectives of reducing gun violence, to me, is consistent with a lot of the other issues, whether it's homelessness or hunger or gun violence or other things. It all gets back to the basic neurology of the brain. And policies, we've got a lot of policies already out there. The policies are not fixing this problem. And so to me, these problems are like having pandemics without any vaccines. And I think we need more vaccine-like programs that will actually address the issues that create the problems in the first place. So I'm in favor of adding it to the list of things that we are focused on to try to impact them, but in a very innovative way. We know we can add more services, and we're adding more services, and there's never enough services available to help everybody. But until we start reducing the curve of this pandemic, we are never going to have the amount of money to really fix the problem. So I'm always in favor of doing things earlier, and that's what I would like to find, is some solution that addresses all of these concerns. Thank you.
Yes, thank you. And Commissioner Carvalho, I see that as well. I don't think this is a completely new area. I think it does dovetail with what we've been talking about. When we're talking about schools and we're talking about trauma and we're talking about suicide prevention, we have been very intentional about gun violence and the use of guns when we're talking about suicide. So I don't think we're creating a whole new area of focus. I think it is about learning more of how it impacts the work that we're already doing. So I don't want this to seem like, a whole new area, but rather dovetailing and being intentional about what we can learn from it so that we can really build into those projects that we already have built out. So thank you for that.
That makes sense. And I would be in favor of spending resource, whether it's a committee or some other form, I think is what I'm raising the question about, like Commissioner Danovich is.
Thank you. Other commissioners? I didn't see that little digital hand. I'm sorry, Commissioner Templin, please.
No worries at all, Chair Madrigal-Weiss. I want to thank you for just the opportunity to have this discussion, and also the focus on just the impact of these events in our lives. And as my fellow commissioners and yourself shared, like there's a lot of connection to the work that we have been doing, like prevention and early intervention work, the school mental health, post-crisis, the triage work. And I think another area that I want to emphasize that has been a long time for our state to refocus on and is the stigma, prejudice, and discrimination efforts around people who, like myself and Commissioner, Chambers and others that are in the consumer, have the lived experience and have that, experience with the mental health system, and then seeing and in our media, the quick vilifying of someone who struggles with mental health challenges, and the myth that we are, there's a myth, right? We're more likely to be victims of violent crime than the perpetrators. So that, like, maybe highlighting that area, refocusing on like really what's happening. I've seen a lot of times where we move into these, something horrible happens, even locally, it may not even be national, but the reaction is to get more into the courts, get more into forced treatment. And the reaction from us that have been receiving services is, I'm going to stay away from that kind of approach because of, the harshness of it too. And so I think the opportunity to really have a thoughtful conversation to bring in those points and refocus. It's, again, I think it's been over 10 years since our state has looked at the prejudice and discrimination of people struggling with mental health challenges in this area. And because of that, we have a reaction to do something, but it's not always the right action. And for us to have a conversation about the right action is, I think, an opportunity. So thank you.
Thank you, Commissioner Templin. I see Commissioner Bunch.
Hi, yes, I just wanted to kind of follow up on some of the comments that have been made and just point out that addressing gun violence isn't necessarily new for the commission. We have several suicide prevention initiatives underway currently that address issues around gun access and safe storage. But I also want to acknowledge Commissioner Danovich's comments around taking on too much, because I feel like I've said that in the past that, you know, we can't do everything, even if we want to. But again, this feels like such a big thing to ignore. And I want to just personally volunteer myself to be a part of this and help direct it and guide it and really help with it in any way.
Thank you, Commissioner Bunch. Commissioner Chambers.
Thank you. I just want to echo Commissioner Bunch. The work that is needed around trauma, and particularly with communities of color, is real. As a Black peer and someone that has witnessed a 14-year-old get shot and killed in Pomona, and see, you know, still dealing with the trauma, and just like, you know, it's not about even, you know, how you grow up sometimes. It's just like the family and your environment. I think that we have the opportunity with school mental health as well, and prevention and early intervention to do a lot of this work. A lot of the gun violence that I experienced personally and witnessed was a lot from youth, and, you know, a lot of youth not having things to do, a lot of trauma. So definitely there's an intersection, and I'd love to be a part of, you know, working on, like you said, Madam Chair, about dovetailing specifically in some of the areas that intersect with the work that we're doing already. But just want to reiterate, like being a woman of color, I believe it just disproportionately, we have, you know, traumas that other groups that don't go through. Like I said, witnessing someone, you know, get shot and killed, and my family wasn't directly involved in that. It's just, you know, a part of, you know, somehow our culture has been disproportionately impacted. So, you know, definitely want to make sure that we figure out, like, with some early intervention and work like that. And yeah, thank you.
Thank you, Commissioner Chambers. Commissioner Vice Chair Alvarez.
Thank you, Chairman Alvarez. You know, so I really appreciate this conversation between commissioners, and at the risk of repeating or just cheerleading other people's comments, I do think this is an opportunity to follow through on commitments we may have alluded to, or things we have said we wanted to explore, to be more action oriented as a commission. I think there's just ample opportunity for discussions and incredible reports that have been written. And what is the commission's responsibility or authority or place to actually do something on this issue? You know, to Commissioner Chambers' comments about prevention and early intervention, you know, that report just came out. For those that have taken a look at it, it does speak to many of the macro level issues that are impacting families and communities that manifest themselves in mental health challenges. And there's no denying that those challenges disproportionately impact marginalized communities, low-income families, people of color, immigrant communities. And those are the same families that are often disproportionately impacted by gun violence. So in a way, this committee can start to explore not necessarily what, you know, new reports we can write, but what are the action steps we can take in response to the work that's been written? And where can we, partner more effectively with counties? Where can we hold partners accountable, and vice versa, hold us accountable to that commitment? And I think that would be something that's welcome to the field more broadly. There is this better understanding around mental health and mental health and well-being, I think, in California and across the country. And perhaps this is an opportunity for the commission to contribute substantively to that conversation. The one thing I will caution us, and maybe this was just me, in my first reading of the committee, I got a little nervous in that we're making the connection between gun violence and mental health, where we know that is not backed up by research, right? That people who have mental illness are more likely to, be violent. That is a myth. That is a very frightening myth that I think media tends to perpetuate, when really it's the impacts of gun violence that actually have mental health impacts on our children, on our communities. So I really appreciate the comments that my fellow commissioners have said to make that clear from the commission's perspective, our perspective going into this work. So thank you for that.
Thank you, Vice Chair. Agree absolutely. And when I think about all the initiatives that we've taken on, like I said, our schools as centers of wellness, our PEI report, our suicide report, and all we're doing there, and how we dovetail, braid in trauma. And so I see that, if we're talking about community wellness, family wellness, individual wellness, and we know the impacts that, gun violence plays at all levels. So I go back to, I'm not trying to add more. I'm trying to be cohesive and braid through, and this absolutely affects all, right? It affects at all levels. So I appreciate all your comments. I ask if there are any further comments or thoughts around this, and then I will open it up to public comment, and we'll move from there. And thank you for sharing thoughts at all levels. I'm sorry, was somebody going to say something?
Commissioner Mitchell.
Thank you, Commissioner Mitchell. I'm sorry, I don't see you. There you are. Please, Commissioner Mitchell.
I agree with our comments by our commissioners on this issue. I totally understand Commissioner Danovich's point. I think the plate of the commission is full, but I do believe that there is an intersectionality here that we need to further explore, to the point that gun violence does affect our communities and our mental health. I think it impacts PTSD. I totally would be interested in the commission doing some research in this area, just to have an impact on what this gun violence is doing, not only in California, but across the nation, because these are very, very troubling incidences of massive, enormity. Just the thought of taking out 19 children or, 26 children. I can remember where I was the day when those 26 children were killed at that school. That has never left my mind. And so I think we are obligated to at least say, with data, and I do appreciate, Commissioner Carnevale's approach, because he's always, let's look into how can we do some prevention? How can we take some steps to see what we can do to impact a change in direction of these unfortunate situations? So I think we're almost at a point where we're obligated to at least do something. And I don't know what that something is, but we cannot ignore this.
Thank you, Commissioner Mitchell.
Mara, if I can make just one follow-up comment, just to clarify my recommendation, it sounds like the subcommittee will go forward, it would just be, I agree that this is definitely a cross-cutting issue that touches many of the commission's portfolio of activities. But my suggestion would to enable us to focus would be to be thinking tactically about initiatives within prevention and early intervention, to think about our existing initiatives and how we, how each of them are affected by and effective within this space. And I think for a lot of broad-based societal issues like that have mental health impact, like immigration, like gun violence, things that are beyond the scope of mental health but have major mental health sequelae, I think that we just have to be really, really strategic and tactical about how we grapple with them so that we can maintain our focus, action orientation, and progress, and that we separate the top-down issues that we're addressing around the core mental health outcomes that we're driving towards, and then the sort of bottom-up sequela of things that we also want to be sensitive to and address as we go forward. So anyways, just a 2 cents.
I appreciate that, Commissioner Danovich. And I think, as we consider moving forward and, thinking about this, I think just hearing from our fellow commissioners, I think just we'll have to be really thoughtful about this and what that looks like. And, in leading this to be thoughtful, that we're not just, that we are dovetailing it, that we're not adding on, that we're really being thoughtful about everything that's already in existence, and how do we make sure that it complements and not that it complements, I guess, the work of what the commission has been doing. Commissioner Gordon, please.
Thank you, Chair. Unfortunately, I missed much of the prior discussion, but I have to say I share some of Commissioner Danovich's anxiety about pushing ahead with something before we've done research on what we're even proposing to do. Because if the proposal is just to create a subcommittee to explore and so on, I would prefer to do that after having done a little bit more research on exactly the areas that we are proposing to touch on. And also, it strikes me that we have a law enforcement person on the on the commission who is not on the call today and who's not privy to the discussion. So it might be wise to get his input as well.
Thank you, Commissioner Gordon. And there has been discussion with Commissioner Brown. So, and I think this came out of conversation from the May meeting, just everybody's response to this, and just, what should we be doing? And a lot of it was from the feeling of, not one more silent moment, right? Not, here we go again. And since then, there's been more issues around this, and it's just how it's truly affecting everything. It's affecting practices. So, and there's been conversations, and this is just in the field, right? In Children's Hospital, there's been conversations. In schools, there's been conversations. And it's just, is the conversation following the research of what we know? And are we going to what we're feeling, or are we going to what the research is saying? So as a commission, what we have been saying is, are we following, the science and the research? And do we have that ability to do so? So having a group, having a subcommittee come together to bring together those subject matter experts, where we can actually bring forward those conversations and maybe produce, the venue where we can have those conversations, where we're able to put that out there. Commissioner Gordon, so I wanted to clarify that.
Okay.
So any other comments from our commissioners?
Sure. This is Commissioner Bontrager. I just want to clarify my comments from a few meetings ago.
Yes, that was in May. Thank you.
Yeah. My concern was more that how, at least my experience has been, that we ascribe a mental health issue after any act of mass shooting, anything we can't fathom or we find illogical, we ascribe a mental health issue to it. And my hope is that we can I think it distorts the issue. And my hope is that we don't continue to do that. My fear with this proposal is that we might be complicit in doing that unwittingly. And I hope if we do take this on, it's more about the impacts, the mental health impacts of mass shootings, not the causes. Because my fear is that we will continue to have a distorted public discussion around the cause of mass shootings as a mental health cause. And I think that distorts it. I don't want us to be complicit in that conversation.
I would hope
Thank
a part
you.
of this, I'm sorry. I mean, I would hope a part of this would be actually addressing stigma and taking on that piece of it to specifically say this isn't what is the cause of mass shootings. I would hope that would be a big part of what we're doing so that we can try to change that narrative.
Yes, Commissioner Bontrager, so it's very much the opposite of being complicit. It would be the opposite of that, and absolutely around the impact of the firearm violence. So I hope that clarifies for you. And I'm sorry, I can't see you. I don't know why we can't see inside the room, but can't see it from this world. Okay, so I see no further comments from our commissioners. So at this time, we will go to public comment. So Mariani, please.
We currently have 2 public comments. Phone number ending in 718. Your line is open. You may go ahead.
Hi, everybody. You can hear me?
Yes, we can hear you.
Oh, perfect. Thank you. I'm never sure. This is Steve Leone, consumer and advocate. And I want to make a comment here about the role of culture in this. And I feel that, you know, want to be very careful whether this is done in a subcommittee or by other means, that in putting out messages, we're very careful about issues of culture. Now, we often think about culture as associated with ethnic groups, etc., but everybody has culture. And that includes traditional American rural people as well. And in that traditional culture, I've often been struck that for many generations, people have used guns, and it's been normalized within their culture and integrated into their social structure for things like, you know, hunting and self-defense in an area where police are a long way away, and target practice, etc. And yes, of course, there were problems at times, but nothing like what we're seeing now. I mean, that was, you know, it was just normalized, and there was no more thought about having gun ownership than that steak knife that most everybody keeps in a kitchen drawer someplace. And I would mention, you know, the author Salman Rushdie was recently attacked and almost killed by a knife, not a gun. And however, the type of guns like the assault rifles, etc., and gun culture or the lack of
Madam Chair, we are having an issue in the Sacramento, a fire alarm or an emergency alarm. So we are in all likelihood going to have to evacuate our building at this moment until we get more information.
Hi, this is
okay.
Cody.
So-
Yeah, we're okay. This on the phone, we got a notification that this was a test of the emergency system, so we should be good to go.
Excellent. That's Cody. Thank you for that clarification. So apologize for the interruption.
Thank you. Can we continue, or did we lose the call? Okay, Mariani, so Do you want to
I
go ahead
think
and unmute that call again? So, I mean,
I will mute. Sorry about that, Steve. You can go ahead and continue. Steve, if you wanted to continue, I think if you push *9, you should be able to unmute. Okay, we'll come back to Steve.
Yes,
Oh,
am
there.
I now unmuted?
Yes, you're unmuted. We can hear you.
Sorry, I mean, there was all this problem on my end. I couldn't get unmuted again. So sorry for this. But I was just making the point about, Salman Rushdie and about people keeping the knife in the kitchen drawer. But clearly the type of guns, assault rifles, etc., and gun culture has come a little bit unglued, a lot unglued from that traditional way of thinking. And in many cases, people and communities are amenable to psychological interventions of one kind or another. And I think that's important, but context should not be forgotten. In many traditional values and contexts still exist in places, especially rural, and including in California. There's a lot of rural areas in California. And these people have often felt not heard. And I would want to make sure that these people in which their gun culture is normalized, and just like owning a steak knife, that whatever you guys produce, do not inadvertently alienate them and make them feel even more unheard. I think we need them as allies, not as someone who's going to be dismissive of what we say. Thank you.
thank you, Steve.
Okay, next we have Teresa. Your line is open and you may go ahead.
Hi, so I put on my other hat for this public comment. I'm the chair of the State Rehabilitation Council that advises California's Department of Rehabilitation. And we were also asked to consider this issue in terms of, our recommendations to the department and to the state. So wanted to just connect with you on that and let you know that maybe this is something that all of the commissions and councils are being asked to consider. And maybe there's some way that we can all be working together and maybe get a liaison from each to talk about this. We do know that there is something called the Bullet Points Project at UC Davis, which is focusing on clinical scenarios, interventions, and how to counsel. And the main focus is on reducing the likelihood of gun injury. So we may be able to maybe put together some type of work group among our councils and commissions. So wanted to express that interest.
Thank you.
Okay, our next comment, Tanya, your line is open. You may go ahead.
Yes, good morning. I'm going to agree with the last speaker, Teresa. Speaking from the standpoint as a grandmother, I have two grandsons, 6 and 9, that attended private school, and now they're going to be going to public school. And one of their concerns was, how will we be protected at school? And it weighed so heavily on his mental wellness that he doesn't want to go to school anymore. So I believe anything that can be done to help educate not only the students, but the parents, to educate their kids on how this won't affect them from generations to come. Because to hear a 7-year-old or a 6-year-old or even a 4-year-old say, I don't feel safe going to school, when that is just a public right, to education, it's kind of frightening. But how do we protect that generation, which is our future? how do we protect that younger generation, from making sure that they feel safe enough that they can continue to have a good education? Thank you.
Thank you, Tanya.
Chair, we had 2 comments come in after the last final comment. Do you want to take those?
Yes, it's fine. Let's just make sure we have a final, please.
Okay. Call-in user, your line is open. You may go ahead. There's not a phone number, but call-in user _1. Okay, maybe not. Sharon Yates, you may go ahead. Your line is open.
Good morning, everyone. I just wanted to ask everyone to think about the possibility of having the commission to partner with companies like Rand Corporation, or maybe the FBI and maybe the UC system, and each one of us take a segment. So like UC would take youth, we would take mental health, behavioral health, and FBI would take the police aspect of gun violence. And we create a study, maybe 2 or 3 years, and we actually come up with solutions for each segment of our society. It's just something to think about. I know our plates are full, and I just wanted to throw that in the fire so that we could think about it. Thank you.
Thank you.
And that was our final public comment.
All right, thank you. So I would ask, go ahead.
Hi, this is Mark Carments.
So I think we've taken all the comments. We've.
No, I'd like to make one and would appreciate it.
Go ahead, sir.
Yeah, and why not use organizations like the Andrea Cook's organization and the Racial and Ethnic Minorities Disparities Coalition.
Thank you for your comment, sir.
I'm asking a reason. I'm asking a question.
I'm not prepared to answer your question at this time, sir. This is just to hear your comment. Is that your comment?
Okay, yes.
I appreciate your comment. Thank you, sir. So, Amirani, are we closed for comments now?
Yes, we should be done.
Thank you. So at this time, based upon our commissioner's remarks and the comments by the public, I would entertain a motion.
I'll motion to create a subcommittee on firearm violence prevention, ensuring that we take into account existing initiatives and are sensitive to issues of stigma.
A second.
So it was Commissioner Bunch and Commissioner Tamplin?
Yes, that's correct.
So do I have any other comments from commissioners? Commissioners, I don't see any. So I would just like to add, Commissioner Bunch, if we could, just to be really intentional that we're talking about, preventing firearm violence, but its impact on the individual, family, and community mental health and well-being. Because we talked about it, how it's affecting all of it. Could we add that? Would that be?
Yeah, yes. Do you need me to restate it like that? I don't know if I can.
I just want to make sure that we're adding it, that it's all inclusive of that.
Yes.
Just those 3 points. I'm sorry, just because I kept saying individual, family, and community that I wanted to be.
So do we need to redo the motion, or?
I'm not trying to confuse things. And I ask for everybody's forgiveness. This is the first time I've ever done this. So please, all grace, I'm asking. We have a motion. No, you know what? I don't think we can change it. So that's just me speaking out loud. We had a first, we have a second. Let's go with that. Sorry, Commissioner Bunch. Don't mean to do that. So we have a first and we have a second. And at this time, are there any comments, further comments from our commissioners?
This is Gladys. I'm just curious. I don't know. I thought we could amend motions, but nevertheless, can't we, because there were some very rich comments regarding, what this is about. I mean, Steve, he raised the point of rural communities who, look at these issues very different than maybe an urban community. That was not his exact quote, but that's kind of what I took from his statement. So I think more than anything, I just want us to be clear that part of this work is exploratory in nature, and it's also collaborative, because there were some very good organizations that were mentioned that could potentially, collaborate on this effort. And so I want to make sure that we're not biting off this whole new big direction of something that really can't be done, or we miss the intent, because I think we're all concerned, but it's really about, Commissioner Bunch, and you help me, the impact. And we're really trying to stay away from the stigma of saying every incident because of mental health. So we got to really be clear and flush out what we're doing with this.
Agreed.
That's my thought.
Yes, thank you, Commissioner Mitchell. Absolutely. Any other comments from our commissioners?
Commissioner, this is Jeff, your legal counsel. I would just like to point out that we have a couple of paths to either amend, modify, or replace the motion. If you would like to do that, staff has prepared a motion that I think encompasses both your comments as well as Commissioner Bunch's original motion. If you'd like, we can even share that language on the screen before you move forward towards a vote, if that would be helpful.
That would be helpful, please.
Cody and team, could you please put the motion up on the screen?
So I don't know, at least in my home, I don't see this. I see it as a little block. Is
there a way to make it bigger?
We're seeing all the multiple little, or is that just, go ahead.
It was up briefly and then it disappeared as a bigger.
Right. So right now we're seeing all our little, there we go. Thank you.
Would just one point, if the word stigma reduction be added, because I remember Commissioner Bunch in her motion emphasized that piece. I think that really would be helpful.
And it does include also what Commissioner Mitchell also wanted to make sure that we were exploratory. So it is exploring the opportunities of, and if we could somewhere there add the stigma that we talked about.
Yeah, and I'm gonna make this even more complicated. But if we could just change the last part of it, including strategies and to improve understanding of the relationship between firearm violence and how it impacts mental health. Because we don't want to make the association between mental health and firearm violence. That makes sense.
Yes. So Jeff, I'm assuming that's happening somewhere.
Yeah, I'm
Okay.
correct,
Yes,
Commissioner.
please. I'm sorry. No, it's all good.
The only the first one, stigma. I'm just trying to figure out where exactly to include that, and I've taken care of the other comment, and we'll have a new motion here shortly.
Okay.
Maybe we could just add on consider and are sensitive to issues of stigma.
Okay, Commissioner, I'd like to read what I think is a possible replacement motion based on the comments that were just made. And much of it is very much the same up until the very end of the motion. That the commission approved the creation of a subcommittee to explore opportunities to prevent firearm violence and its impact on individual, family, and community mental health and well-being, including strategies to improve understanding of the relationship between firearm violence and how it impacts mental health, and sensitivity to issues of stigma. Maybe it should say with sensitivity to issues of stigma.
And if we can see that on the screen so that commissioners can see it.
While it comes up, I would just, I would speak against the portion of it that speaks to prevention of gun violence. The latter half of it speaks to the impact of gun violence. And, but just if we take this charge, literally, I think that to really take on the prevention of gun violence is a major scope expansion.
I agree with that. I think I have got that reflected in the slide now. Please let me know if I made any mistakes.
That is correct. However, there have been comments, Madam Chair, since this language was created. So I'm not sure if there are additional changes that would like to be made to the motion with respect to reference to firearm violence.
This is Commissioner Mitchell. I think that motion still had, can you put it back up? In the first sentence, that the commission approved the creation to explore opportunities to prevent firearm violence. I thought that's what we were talking about taking out. Because I thought we were looking at its impact and the stigma.
Chair Medical Weiss, this is Ashley Mills. I'm a research supervisor with the commission.
Please.
May I offer revision that the commission approve the creation of a subcommittee to explore opportunities to address the impact of firearm violence on individual, family, and community mental health and well-being?
Yes, thank you, Ashley. And thank you, Commissioners Janovich and Mitchell. Yes, that is, as read, a very big lift alone from our exploratory subcommittee. And so, Jeff, we're making those changes so we can see them on screen and then we can call that vote, correct?
You're muted.
I am?
I believe we had the motion up on the screen just a minute ago. Can we bring the motion back up? Any additional revisions to the motion?
I think that incorporates everything we're saying.
So Commissioner, I'm not sure if you could hear me before, but we have a couple of mechanisms to replace this motion with the other motion if you'd like, the easiest of which is if the maker of the motion, Commissioner Bunch, is receptive to this change, she can accept this friendly amendment. And if the second of the motion it does as well, this will replace the previous motion and we can move forward.
I accept this amendment.
I do too.
Okay,
Yeah, so
I'm
this
sorry.
is now the motion. There has been, to respond to Commissioner Mitchell's question, this has been moved and has been seconded.
Thank you. So are there any additional questions or comments from our commissioners? And I'm sorry, now we have this on big screen, so I cannot tell. Can anybody there tell me if there are any additional?
I see none.
I'm sorry, you see?
None. I don't
Okay.
see any. Yes.
Thank you. So thank you, everyone. Mariani, I will ask you now to please take roll on the motion. Mariani?
Hi, Chair. I think we lost Mariani, but we're getting her back up.
It's just one of those days. Okay, all right. If this is the biggest bump of the day, I will take it. I will take it because I'm taking it with my friends. So it's all right. It's all right.
You want me to call the roll for this motion?
Who's saying that?
Mariani.
Mariani, are you back?
Yes, we're back.
All right, then yes, I would love for you to take the roll on this motion.
Okay, great. Commissioner Bontrager.
No.
Commissioner Boyd. Commissioner Brown. Commissioner Bunch.
Aye.
Commissioner Carnevale.
Yes.
Commissioner Carrillo. Commissioner Chambers.
Aye.
Commissioner Chen.
Aye.
Commissioner Cortese. Commissioner Danovich.
Nay.
Commissioner Gordon.
Aye.
Commissioner Mitchell. Commissioner Rolette. Commissioner Tamplin.
Aye.
Vice Chair Alvarez. Oh, sorry, I think you're muted.
Sorry. Aye.
Okay.
Forever. Get my mouse.
Chair Madrigal-Weiss.
Aye.
While Mariani's counting the votes, Commissioner, I just wanted the record to reflect that two commissioners have added since the roll call was made at the beginning of the meeting. So Mariani, if you could indicate that before you announce the vote.
Yes. Commissioners Gordon and Commissioner Bontrager joined us around 10 a.m. So they are now with us here. And for the motion, there were 9 yeses and 2 noes. So the motion passes.
All right. Thank you, Mariani. So as we have moved forward with this, at this time, I would like to appoint Commissioner Bunch as chair of this subcommittee. And if there are other commissioners interested, and I've heard interest, I would ask that you let staff know. And we will follow up with commissioners with more questions and keep you updated on this. And yes, Commissioner Mitchell, we know it will be exploratory and we do want it to be collaborative. And we will, continue to work out what this is going to look like exactly. So thank you so much, commissioners, and we will move forward. So next, we will move to agenda item number 6, and the commission will consider approval of the 22-23 fiscal year spending plan and associated contracts. So we will be hearing from Deputy Director Norma Pate as she will present the fiscal spending plan. So Norma, I turn it over to you.
Great. Thank you so much, Chair. Thank you, commissioners, for your time today. I'm going to make this a little bit short because we're running behind on time, and I want to have make sure that Tom Orrick has enough time to present his plan for the immigrants and refugees. Cody, if you could go to the budget slide for the 21-22 budget, please. Last year's, our budget was approximately $255 million. Most of the funds from that year was for our Mental Health Student Services Act program. And we've administered that program and have allocated funding for that program to 57 counties. So counties are in the process of implementing their programs for the mental health school county partnerships and begin to provide services to youth in schools and children. We have approximately $160 million that we had spent from last year's budget. We still have funds to spend from last year's budget. Those funds are available over multiple years, so we'll continue to spend on these funds for the next several years. I want to mostly thank commissioners for their time and dedication to commission. and the time that you spent in helping us implement these programs and on the committees for these programs, and to our community partners for the listening sessions that you attended to help guide us so that we can allocate these funds appropriately, and to staff who have spent lots of time and dedicated hours to making sure that these funds are out, and we were able to get these funds out in a year, and I'm very proud of the staff that worked on these projects. Moving on to the next budget overview. In 22-23, our budget has decreased because of those one-time funds in prior years. We're still spending those funds, as I mentioned, but our budget has decreased this year to $111.7 million. Our expenditure plan for this year is the next slide. There you go. Next slide. Sorry, Cody. Yeah, there we go. Thank you. We have presentations for you this year today, and then the next presentation will be our mid-year update in January. And then our final report for 22-23 will be in July of 23, sorry. Next slide. I wanted to highlight some of our budget proposals that we submitted this year. Last year, the commission directed staff to work with the legislature to seek funding for 4 legislative proposals and modifications to the Mental Health Wellness Act grant program that provided funding for limited term staff for crisis prevention programs. The commission submitted and the legislature and governor approved funding and modification for programs. The commission received $5 million one-time funds to establish a behavioral health fellowship designed to drive transformational change and reduce racial, ethnic, and cultural disparities and mental health outcomes. The funds will be used to launch a partnership between the commission and an academic institution. We also received an augmentation to our immigrant and refugee advocacy contracts in the amount of $670,000 annually. This will provide additional support to our immigrant and refugee communities, and Tom will present that presentation to you today so that we can get those funds allocated out into our communities. We also, for the first time, received funding for K-12 advocacy contracts. This funding is $670,000 and will be annually, and we will be coming back to the commission for approval for an outline for this after we've held listening sessions to hear from our community. We also received modifications to the Investment in Mental Health Wellness Services Act of 2013 language to better address the goals in the act to improve crisis response, reduce hospitalization and criminal justice involvement of mental health peers, and leverage public and non-public sources of funding to improve access to care and well-being. The commission will be presented with a spending plan for these programs at a future commission meeting. Next slide, please. I'm sorry, forgot one thing, sorry. We also had peers in California state government. We submit, in addition to the above items, the commission requested funding to establish a leadership role for mental health peers in California state government. The administration modified the commission's request and shifted the responsibility to the California Department of Human Resources. Staff will work with CalHR and other state agencies to evaluate the feasibility, efficacy, and alignment with existing state personnel classifications, policies, and goals of incorporating the role of behavioral health peers into the state civil service. CalHR will report the findings of the evaluation to the legislature for this project by June 30th, 2024. We also received approval for a new deputy director to support an increase in workload for legislative responsibilities. We are developing the job announcement for this position and will begin the recruitment process for this position in the next few months. In addition to the deputy director position, the legislature and the governor approved 9 additional positions to support the administration and evaluation of the Mental Health Student Services Act grant program and the increased workload for our advocacy contracts. We started our recruitment efforts for these positions in July and hope to have these positions filled soon. Sorry, now I'm ready for the next slide, Cody. Thanks. Right. So I'm just going to quickly go over the slides so that we can move on to the next presentation. But we Like I said, we've increased our personnel to 8.1 million now, and our core operations is 1.4 million. For our commission priorities, we've set aside funding for our communications efforts at about $400,000. And for our innovation activities, 100,000. For our research and evaluation, this is mostly for our contract with UCSF to support our evaluation efforts. We have about 1.16 million for contracts. And then for our budget directed items that I just went over, we have the California Behavioral Health Outcomes Fellowship, $5 million. And we will present an outline for that project at the next commission meeting. We also have for our evaluation of the FSP full service partnership. Do you recall last year, the commission supported SB 465, authored by Senator Eggman. The governor approved the bill, and the 2022 budget includes 400,000 ongoing funds to support the outcomes for those receiving community mental health services, and under a full service partnership to help strengthen full service partnerships to reduce incarceration, hospitalization, and homelessness. We also received one position for this work. And the next item here on the list is the mental health services evaluation, student services evaluation and administration funds. We received $16.6 million for the administration and evaluation of this program. And that we are in the process of hiring staff to help with the administration and evaluation efforts. And then we will come to you with a proposal on funds for that we will contract out for these services. The commission also receives funds for local assistance. So we continue to receive funding for our triage program. We'll come back next month with a plan for those triage funds. As I mentioned, the language for that was modified, and so we'll be presenting a new proposal to you at the next meeting. And then our Mental Health Student Services Act funds is 8.83 million of ongoing funds. Those funds have already been encumbered and allocated to counties. And we received $6.7 million, which is an increase of about 1.4 million from last year for our community advocacy contracts. We also have funding, it's 42.9 million. As you recall, the governor's 21 budget included 4.4 billion to support an array of projects to improve behavioral health outcomes for children. Those initiatives included 429 million to identify and replicate evidence-based practices with a focus on reducing disparities and meeting the needs of youth with complicated high-end needs. The Budget Act of 2022 allocated 42.9 million to the commission to support the identification and adoption of evidence-based practices. The commission staff are working with the Health and Human Services Agency to finalize an interagency agreement for these funds, and we will share more information with you on this program later this year. Next slide, please. Today I have two contract requests for you to consider. The first contract request is for the Well-Beings Initiative. As you may recall, in 2019, the commission invested 300,000 in the Well-Beings Initiative, which resulted in the creation of mental health resources for youth, teachers, and counselors, and the creation of a documentary, Hiding in Plain Sight, Youth Mental Illness, produced by Ken Burns. Next slide, please. The documentary centered the stories of 23 young people and their journeys with mental illness. It was premiered in June on 330 plus PBS stations throughout the country. First Lady Jill Biden hosted a screening at the White House, and future screenings are scheduled for the National PTA. As the chair mentioned in her announcements, the commission will host a screening in September. Next slide, please. The commission received an update from the film executive producer, Tom Chiodo, at the February 2022 meeting and requested an additional 500,000 to continue the national engagement campaign through 2023 and to support a second documentary series, Hiding in Plain Sight, Adult Mental Illness, slated to premiere on PBS in 2025. The commission's investment in and the first film helped bring the message of the youth mental health crisis into the homes of millions of Americans. Supporting the second investment intersects with the Commission's strategic goals and will continue to support youth, educators, and the upcoming film will underline our work around workplace mental health, prevention and early intervention, and adult and older adult mental health. Next slide, please. The Commission may wish to consider investing $500,000 to continue the national engagement campaign through 2023 and to support a second documentary series for adults. In addition to the Wellbeing Initiative, staff is asking the Commission to consider approving an IT infrastructure contract in the amount of $156,000 to allow network connectivity to the Commission's new office. As you can tell today, we've had some problems with our network. The next slide is the proposed motion for the Commission to consider, and I'm happy to answer any questions you may have.
A quick question, just out of interest. You mentioned the Mental Health Student Services Act at 57 of the 58 counties. What's the one county, the lone county that's not been awarded a MHSSA?
Alpine.
Alpine. Okay,
They're,
thank you.
They're a really small county and they didn't have the capacity.
Okay.
We reached out to them, tried to support them, but it was still too much of a workload for them. Any other questions, commissioners?
I'm
Just,
sorry.
just as a note on Alpine County, most of the students go to school in Nevada.
I apologize. I was bumped off the call. I'm back. So glad it all kept going.
Would you like me to repeat anything as far as the motion, Chair?
No, please go ahead. I captured that you were at motion.
I don't think we have any other commissioner questions for this item.
Okay, so at this,
the public comment now?
yes, please.
Okay, thank
We will
you.
move on to public comment. So at this time, members of the public may request to make a public comment on the agenda item number 7 by raising your hand, button on your computer or the app, or if calling in, *9. So once the public comment, I'm sorry, was this already said?
No.
Okay, I'm sorry. Once
You're
the
right.
public once the public comment period for this agenda item starts, we will close the public comment queue. So please make your request to comment now. And please limit your comments to 3 minutes or less. Mariani, please open the line for public comment on item number 7. And I see that there are public comments, so let's go ahead and get started, Mariani.
Okay, great. So we have 3 public comments. The first one, Anna, your line is open. You may go ahead.
Thank you, Commissioner. So yeah, a few comments. I'm so glad we're focusing on our youth and children. The thing that caught my ear as we were discussing this was that this video, this documentary is using medical model terminology, words like mental illness. I'm sure there is more in the documentary itself. I feel like consumer perspective needs to be represented better. I want to remind us that MHSA was created so that the client of the system has a voice. We know that our mental health system is still one of the very few places where the customer is always wrong. So the idea was to change that. And so I want to urge us to start using correct language like mental health challenges, like recovery language. We know that language matters. And when we're getting this message out into the world, it's very important how we word things and how we present things. Also, it is crucial for folks to see and hear the message of hope from those who look like they are. Appropriate communities, appropriate age range, not from the family members, not from the providers of services, psychiatrists and psychologists, but to include their peers that accomplished something, that were able to get better. So that's my comment on that. Also, so community Is there any place where I can see who recipients of those contracts and what is being funded? And also, is there a tracking for those contracts? And as you're discussing budget, I want to urge you to start allocating funds for to help form a consumer peer association as we're implementing SB 803. We're really, I feel like all of our consumer programs are still very underfunded. There are not a lot of them. And so when that happens, you don't get the best staff, you don't get the best training. And then when things don't work, we hear things like, well, we need forced treatment. So I know I'm kind of covering a lot, but you have so much power in your hands. So please try to see if those things can be implemented. Thank you so much.
Thank you, Anna.
Next, we have Elizabeth. Your line is open. You may go ahead.
Thank you. Actually, my concerns mirror Anna's. So I've been, I'm in Ventura County. I've, for the past several years, been following how the student wellness centers are going, and really been thinking about this quite a lot. So I'm very concerned that the film's labeled mental, is focusing on illness. And when we go over the instruments that are being used to assess mental well-being, they're not really assessing mental well-being or resilience. They're looking for symptoms. And I think we really know that when the brain is primed to be looking for things that are causing distress or things that could be labeled symptoms, that's what the focus is on. And, people that may want some support for something that has a natural emotional reaction to events in their lives are directed into labeling and pathologizing their emotions and reactions. It's really detrimental, and especially if then the immediate reaction is to start prescribing medications that we've seen can be difficult to get off of later on and have their own cascade of side effects, which then require additional meds, et cetera, et cetera. So I'm just really that we have of really focusing on the distress, the symptoms, the quote illnesses, and then to have like the follow-up is not like recovery or well-being or kind of next steps, but to continue to label this as adult mental illness is really a disservice, I think, to all of us that are living with mental health challenges and have a lot of information, experiences to share with people to how to function and really be contributing members of our community, our varied communities and our society overall. So, I continue to kind of wage this fight on a local level, but again, I'm just really, really concerned to kind of perpetuate this priming toward illness for what in many senses may just, I'd like us to really focus on resiliency and skills and how people move forward through adversities. Thank you.
Thank you, Elizabeth.
Mandy, your line is open. You may go ahead.
Wonderful, thank you. First, I want to say thank you to the two folks who went before me, the consumers. As somebody who lives with depression and PTSD, I really just appreciate you drawing attention to the importance of language, particularly stigma reduction and having those conversations and how important our language is. So thank you. And what I wanted to comment on, though, is taking a look at the budget for the community advocacy. I'm fairly certain that's the sort of line item that the stakeholder advocacy contracts, like Out for Mental Health, are funded through. And there's the 8 populations that the MHSOAC funds for community advocacy. they're vital. They're really vital to our community, engaging in local and statewide work and being able to build coalition across the state for advocacy within the county systems, and then also systems-wide, statewide change, working together and having the resources to do so. So I saw that there's a 70% reduction in the funding that's going to that community advocacy. And I'm only making an educated guess at the two reasons that might be. One reason being the one that is easiest that comes to mind, which is that the budget is being cut by 30%, and the stakeholder advocacy contracts will receive 70%. But the other option that I think might be the case is that you're going to backload the contracts like you did for this 3-year cycle, where there was a smaller amount in year 1, where there was 5 local projects, and then a little bit, and then more funding in year 2 when there's 10 local projects, and then more funding in year 3 when there's 15 local projects, which was problematic this cycle. We told you it was problematic before the RFP went out. It did not allow us to equitably disperse funds to our local partners and to support our local partners. We had people who wanted to engage in the work that didn't have resources to engage in the work until the 2nd or 3rd year. But even more concerning for this next cycle, if it's set up in that same way, where there's a less amount at the beginning and then more at the end, is that means we're going to need to tell 10 or 5 and 10 of our partners that they need to wait a year or 2 years before they can continue getting funding for the work that they're already doing. So we now have these 15 local partners engaged in the work locally, that if it's set up the same way next time, we're going to have to tell 5 of them, sorry, you're going to have to wait 2 years, and we're going to have to tell 5 of them, sorry, you're going to have to wait 1 year before we can fund you to continue your task force, to continue your vital advocacy work that in many cases is sometimes the only funding these really small local organizations, particularly our folks in rural communities, our BIPOC-led organizations.
Thank you, Amanda. Your time is up. If you can wrap up. Thank you.
Yes, absolutely. Sorry. So thank you. And I hope you'll take that into consideration when you're looking at the budget and making those decisions.
Thank you, Mandy.
And our final public comment, Mark, your line is open. You may go ahead.
Hi, this is Mark Kremetz. I'd like to know the name of the film that Mr. Burns is going to be presenting, and when, and if it's going to be shown on television, or will people in the Los Angeles and lower parts of California will be able to get to the thing.
So thank you, Mark, for your comment. So that's the last public comment. Mark, I will have staff respond to that. So we will get to that. However, so those two things, staff, if I can have you respond to Mark's comment about the film, where it can be watched. But first, I do want Norma, if you can just answer the question: is that accurate? Is there a 70% reduction? And then if I could have staff respond to Mark and let him know where we can watch, where there will be a viewing. I know there's a viewing of the film, but the name of the film and where it can be viewed beyond the screening in Sacramento. So Norma, if I can have you please respond to the question about the reduction.
Yeah, absolutely. No, there is no reduction. We did shift some funds, which is, for COVID impacts in prior years. And I believe that was in 2019. However, it did not impact the stakeholders. It was just a matter of moving some funds around during that year to address the emerging needs for COVID. There is 670,000 ongoing funds for now 8 different populations, and then a little over 1.2 million for the immigrant and refugee populations ongoing. And that will have no impact to our stakeholder organizations.
Thank you, Norma. And if we can also respond to Mark's comment, please.
I think Andrea from on communications, are you on the line with us? Or is that information posted on our website for the filming?
I believe that if you're looking to just watch the film, it is available on pbs.org. There's also, I believe, some national viewings, but you would have to look those up, but it is available on pbs.org.
I think Andrea was made co-host, so she might be able to respond.
Oh, perfect.
Oh, thank you. I was muted. Yes, thanks, Mariani. Definitely pbs.org. You can watch Hiding in Plain Sight, Youth Mental Illness, which is presented by Ken Burns. It's actually directed by the Ewers brothers. And then I apologize, I'm just joining, but I believe we had talked about the presentation or the screening that the commission is going to be hosting in September on the 22nd at the Sophia. And so you can get a preview of it there, but you can watch it anytime on PBS.
Thank you so much, Andrea. And from my understanding, there was a great deal of input by the youth themselves in the branding, in the titling, and the development of the film. So I just wanted to also add that. So thank you so much. Appreciate the comments. And at this time, if there are any other questions or comments from my fellow commissioners. Okay. I'm sorry, Commissioner Gordon. No.
No.
Okay. Sorry, I just saw you light up. So do we have a motion? Was there a motion? This is when I got lost. I apologize.
Cody, can you please bring up the motion slide for us again? So the motion is the commission approves the fiscal year 22-23 spending plan and associated contracts that were presented today.
Do I have a motion?
So moved.
Second.
Thank you. I'm sorry, I didn't see who made the first motion.
Commissioner Bontrager.
Thank you, Commissioner Bontrager, and second by Commissioner Bunch?
Yes.
Thank you, Commissioner Bunch. Seeing no further comments or questions from commissioners, Mariani, I will ask if you please take the roll.
Okay, great. Commissioner Bontrager.
Aye.
Commissioner Boyd. Commissioner Brown. Commissioner Bunch.
Aye.
Commissioner Carnevale. Commissioner Carrillo. Commissioner Chambers.
Aye.
Commissioner Chen.
Aye.
Commissioner Cortese. Commissioner Danovich.
Aye.
Commissioner Gordon.
Aye.
Commissioner Mitchell.
Approve.
Commissioner Roulette. Commissioner Tamplin.
Aye.
Vice Chair Alvarez.
Aye.
Chair Madrigal-Weiss.
Aye.
And Commissioner Carnevale.
Yeah, sorry, that's a yes.
Okay, perfect. Thank you. There were 11 yeses, so the motion passes.
Thank you, Mariani. Okay, we are moving on to agenda item number 7. The commission will hear about immigrant and refugee advocacy augmentation. At the January 2022 commission meeting, the commission directed staff to seek additional funding for immigrant and refugee advocacy, including opportunities to increase available funding in the current competitive procurement for the Immigrant and Refugee Community Partnership Grant Program. As a result of those efforts, the 22-23 California budget provided an additional $670,000 annually to the Commission for this program. The Commission will be presented with options on how to allocate these additional funds. We will now hear from Tom Orrick, Chief of Community Engagement.
Thank you, Chair Madrigal-Weiss, Vice Chair Alvarez, and Commissioners. I hope to do a few things in this agenda item in the time we have here. First is to provide a background on the Commission's advocacy program, then to provide information about the additional funding that's now available for immigrant and refugee advocacy, and then lastly, to recommend to you a strategy to allocate the additional funding. So Cody, I don't know if we can bring up the PowerPoint. We can go to the first slide. The commission has just over $6 million per year in its budget to ensure that mental health needs of nine specific populations are being represented in state and local mental health planning. So through competitive bid processes, the commission awards funds to organizations that have expertise, the capacity, and the passion to bring the needs of these 9 populations to the forefront of mental health planning. The contracted organizations provide state and local level advocacy around policy, mental health practices, and program sustainability. They offer trainings to providers, and they conduct outreach to the population to ensure that there is appropriate access to services. So earlier this year, the commission directed staff to seek advocacy funding for K through 12 students in response to the funding that is now available for mental health services and child and youth behavioral health, as well as they sought additional funding for immigrant and refugee populations. So those efforts were successful. And as a result, we have additional funding for immigrant and refugee advocacy. We can go to the next slide, Cody. We have had 2 rounds of funding for immigrant and refugee advocacy to this point. In round 1, back in 2019, the commission awarded contracts to 5 local organizations. They each received $402,500 over 3 years to increase access to mental health services. They provided trainings and they facilitated roundtable discussions at the local level with members of boards of supervisors, behavioral health directors, MHSA coordinators, to ensure that the needs of immigrants and refugees in their communities were considered when they were doing their mental health planning. We can go to the next slide. In May of this year, the commission awarded round 2 funding to 4 local level organizations and 1 state level organization. The addition of the state level advocacy organization, which is the California Pan-Ethnic Health Network. This was included in response to feedback that we received from the public and from the round 1 local level advocacy organizations. And we can go to the next slide. So as stated earlier, in response to the commission's urging for more funding to represent immigrants and refugees' needs, the 2022-23 state budget authorized $670,000 per year in additional funds. So this essentially doubled the amount of funding that we now have for immigrant and refugee mental health advocacy across the state. I was looking at some statistics recently on this. 26% of California's population was born outside of the United States, which I thought was incredible. We also, of course, lead the nation in the resettlement of refugees, far more than many other states. And so California, I think this is a very good decision and really welcome to have additional funding for immigrant and refugee advocacy. So we can go to the next slide. So with this additional funding, we have a couple of options. One is to use 3 years of this funding, which would amount to $2 million and $2,010,000 to award grants to the next highest scoring local level organizations and to add $400,000 to the current state level organization, CPEN. Let me explain this a bit. So the 2022 request for proposal for immigrant and refugee, where we've already awarded funds, included a provision that said if additional funds were to become available, the commission could award additional grants to the next highest scoring applicants in the recent procurement. So because the funding was doubled, we could award grants to the next 4 highest scoring applicants in the local level category and then double the amount of funding for our state level advocacy organization. And this is why we put that provision in the RFP, because many times additional funding does become available and we want to be able to act quickly to get the funds out to these organizations. The other option would be to start a new procurement to award the additional funds. So the option that staff is recommending is here on the screen. It's reflected here in this motion. And I'll go ahead and read it just for the record, that the commission award contracts of $402,500 over a 3-year contract term to the next 4 highest scoring local program applicants from the February 22 Immigrant Refugee RFP 002, and that the commission award a $400,000 augmentation to the contract for the state level advocacy organization from the February 22 Immigrant Refugee RFP 003, and that would be to the California Pan-Ethnic Health Network. And with that, I'm happy to answer any questions you may have.
Thank you, Tom. Commissioners, are there any questions or comments?
Just out of interest with what's happening internationally, like Ukraine and potential growing refugees there, especially as winter might set in. Is there federal funds that you anticipate that could potentially be available on top of this? I know this is a little outside of what you're proposing, but.
That's a good question. I think that that's something that probably should be explored by this, what could be a coalition of immigrant refugee organizations led by CPEN. I think that's something we should note and ask them to consider seeking funds or where those federal funds may be. Yeah, thank you.
I have a question.
Please, Vice Chair.
Thanks, Tom, for the presentation and update. Just recognizing the commitment on behalf of the administration to expand coverage to undocumented immigrants, the expansion of Medi-Cal, that obviously is a tremendous opportunity to ensure access to mental health services is available. I'd be curious, as we explore how we're responding to the needs of particularly marginalized communities, as that effort rolls out and is implemented, what the impact is on these grantees, on their work, on what they're hearing from community as far as navigating that system, just making sure that we are aware of how these systems interact so that the dollars we're investing at the local level are leveraging these incredible, additional public dollars through our Medi-Cal program. That should be, the first place people go for resources. So I'm just trying, I don't know how the commission itself can get that sort of input and feedback from grantees over time so that there is a story we can tell that, with the expansion of Medi-Cal to cover undocumented communities, our grantees saw, more access or less access, or here are some more clear barriers as a result of that. So if we can perhaps have some regular checkpoints either through the commission as a whole or through the CLCC, where we could figure out what's happening on the ground as these larger policy initiatives are rolled out.
Yeah, that's great input, feedback. This is one of the reasons why I think the advocates and the public really urged for a state level advocacy organization to help the local level organizations with that effort. And so I think we have a great opportunity here, like I said, to grow a coalition of local organizations that could be supported by the state level organization to address those kinds of items. So thank you.
Thank you, Commissioner Alvarez. Any other comments or questions from commissioners?
I'd like to, Madam Chair, Madrigal-Weiss, just appreciate the advocacy and the work of the MHSOAC staff and, in making this available to our community, our state. It's much needed, and I am in favor of the motion that is proposed to, add to the, the folks that responded to the RFP and also support the statewide CPEN that has already been granted it. So it's expanding the, providers of, and advocates for immigrants and refugees, and increasing the funds for CPEN.
Thank you, Commissioner Taplin. I too want to congratulate the staff. I mean, I know we asked them, gave them that charge, please go seek more and seek it quickly, because we saw the need, back then, and they did so willingly and effectively. And so here that money is to really bring those services about. So thank you, Commissioner Taplin. I agree with you 100%. Seeing no other comments, I don't see them in the virtual world. I don't know, Jeff, if you, anything there, any other comments from commissioners inside the room?
No, Commissioner.
Thank you. Then seeing none, I will move forward asking for comments from the public. So at this time, members of the public may request to make a public comment on agenda item number 7 by clicking the raise hand button or on your computer, or if on the app, please press star 9. Once the public comment period for this agenda item starts, we will close the public comment queue. So please make your request to comment now. Please limit your comments to 3 minutes or less. Mariani, please open the line for public comment on agenda item number 7. I see that we do have public comment, so Mariani, if you can please open those lines, yes. We'll get started.
Great. Steve, your line is open. You may go ahead.
I'm sorry. At this time, I'm sorry, if I could just take a moment. Commissioner Chambers?
Yes, I wanted to put it on record that I want to recuse myself and abstain from this conversation relative to CPEN.
Thank you so much, Commissioner Chambers, and I'm sorry I didn't catch that early.
Thank you.
Thank you. All right, my apologies, please.
Great. Steve, or number ending 718, your line has been unmuted.
There we go. There we go. When you said Steve, there's several Steves that you could be referring to, so I'm never sure these days.
Okay.
First, I just wanted to make a real brief comment as I looked at the choices. This is not an academic discussion. The people from both Afghanistan and Ukraine, which are the standouts here, they're already here in America. They're already here in California. I personally live in an apartment complex that's about 3/4 Afghan. Very much here, very traditional. Their needs are immediate. They are yesterday. They're not something academic to consider down the line. And of the two options I was reading and understand, the second option is to wait about 6 months. And I don't think that's acceptable. Anybody who has a tendency towards, let's be tidy and fastidious about our process, this process should be about them, not about us. I would urge you to go with the recommended consideration. Thank you.
Thank you, Steve.
Anna, sorry, Anna, your line is open. You may go ahead.
Okay, now it's open. Thank you. So I want to second what Steve is saying. I agree 100%. I am part of the, I'm an immigrant from the former Soviet Union, now it's Ukraine, part of the Soviet Union, and I'm also Jewish. So I'm already in contact with Jewish Family Services of Greater East Bay. There are refugees here already, and they need support. I want to say that, ask rather, that as we're awarding those funds, that there will be some stipulation to encourage these organizations that are we're funding to reach out to the community and ask for peers with lived experience, both as refugees or immigrants and mental health, to be part of this effort. I can tell you that in my own experience, coming here 30 years ago, learning from my peers was the most valuable experience because there is nothing else like an immigrant experience. There was a lot of well-meaning and volunteers who were born here, none who didn't speak Russian or Ukrainian. They were very helpful, but that was very difficult. There was a lot that was lost in translation. We come to this country with very little understanding how things work. So again, I want to encourage to get peers involved. Thank you so much.
Thank you, Anna.
Mandy, your line is open. You may go ahead.
Wonderful, thank you. Congratulations on the additional funding. It's really amazing and exciting. And I just want to speak to our experience as the LGBT stakeholder contract with the other contractors within the immigrant and refugee stakeholder population, and with our experiences with CPEN, which is they have been lovely to work with. They have made sure to be inclusive of queer and trans communities and really trying to make sure to address that intersection when they're supporting immigrants and refugees within their communities that might identify as LGBTQ. And that it has always been very heartening to work with the current contractor. So if that's something to take into account when making your decision, I just want to make sure that you all as the commission are aware of the amazing inclusive work that the current contractors are doing.
Thank you, Mandy.
Stacy, your line is open. You may go ahead.
I'll make this quick. Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. I really just want to thank, as Mandy and others have, the Commission for their commitment to the refugee and immigrant communities and for this extra funding. It's recognized, it's needed. Thank you so much.
Thank you, Stacy.
That was our last final public comment. But there is still one more. Do you want to take it?
Yes, please. Let's go ahead and take it, and then we'll end with that.
Okay, perfect. The last comment, Gulshan, your line is open. You may go ahead.
Hi, Gulshan Yusufzai with Mass SSF. We're the nonprofit that provides counseling and various other programs in 5 languages to refugees for the last 15 years. I just want to start out by just thanking the Commission and the staff for being focusing on refugees, as Stacey stated, but also just getting additional funding just to be able to support the refugees that are currently coming into Sacramento, whether it's from, regardless of which country they're coming from. I wanted to just support the earlier comment about the need for supporting peer-run organizations who are serving these refugees with such programs. To put it simply, when you've gone through so much as a refugee, it's really not only does evidence show that within peer support, but it's crucial that peer support programs are able to support these refugees. And of course, the other aspect in terms of cultural and linguistic, just because it's very easy to say that, okay, we'll provide services, but really when it comes down to it and the trauma and everything that we have seen as MASF in the last year from all the refugees we're serving, and I'm sure many would agree, it's a whole different ballgame when it comes to understanding people and having the cultural and linguistic abilities within an organization and history to be able to serve these refugees in a way that would allow them to not have further challenges given the trauma they've already endured. So thank you so much.
Thank you, Gulshan. Mariani, that concludes our public comment?
Yes, it does. That was our last public comment.
Thank you. So now that we have concluded public comment and based upon the presentation and really the previous direction of the Commission that we've secured these additional dollars, I would entertain a motion.
I have a quick question, Madam Chair. Did we see a slide on who those organizations were?
Once we pass the motion, we
Oh.
wouldn't do so prior.
Okay, thank you.
Yep. So
So move.
Thank you, Commissioner, Vice Chair Alvarez, and do I have a second?
Yes, I'd like to second.
Thank you. I didn't see who that was.
Sorry, this Chair Madrigal-Weiss, this is Katara Tamplin.
Thank you, Commissioner Tamplin. So we have a motion and a second. And so are there any comments from commissioners? Any further comments? So then I will have Amariani please take roll.
Commissioner Bontrager,
Aye.
Commissioner Boyd, Commissioner Brown, Commissioner Bunch,
Aye.
Commissioner Carnavale,
Yes.
Commissioner Carrillo, Commissioner Chambers, Commissioner Chen,
Aye.
Commissioner Cortese, Commissioner Danovich,
Aye.
Commissioner Gordon, Commissioner Mitchell, Commissioner Roulette, Commissioner Tamplin,
Aye.
Vice Chair Alvarez,
Aye.
and Chair Madrigal-Weiss.
Aye.
And then just going back, Commissioner Gordon. We have 9 yeses, the motion passes.
Excellent. At this time, I would ask Tom, would you please inform the commissioners and the public of the names of the next 4 highest scoring local program applicants from the February 2022 Immigrant and Refugee RFP?
Great. Yeah, I think we have a slide for this. Here it is. The Orange County Asian and Pacific Islander Community Alliance Incorporated is new to us in terms of our advocacy program. Visione Compromiso is one of our current advocacy contractors, as well as Healthy House Within a Match out of Merced, and then the Hmong Cultural Center of Butte County in Oroville. And then the state level advocacy contractor will augment that contract, which is the California Pan-Ethnic Health Network.
Congratulations to those groups. Look forward to hearing the wonderful work you're going to do in addition for our refugee and immigrant populations. So congratulations. Thank you so much, Tom.
Thank you.
So we are,
Commissioner,
yes, please.
I recommend that you just quickly take a vote to approve the actual award to those organizations now that they have been disclosed. It's a 2-part vote. Commissioner Mitchell asked a very pertinent question in that regard, and that's why it needs to be done in 2 steps. Normally, on issues like this, there's much time between the 2 votes. So it seems a little unusual here because we're doing both steps in one meeting for the expediency that was discussed by the chair and Tom earlier. So what I recommend is that you actually have the commission vote to approve those contract awards to those identified organizations.
Got it. Thank you so much. So then we would ask that, so then a motion to confirm, right, that the commission would confirm its awards of the 402 $500,000 contracts to the following local level advocacy organizations. Those named the Orange County Asian and Pacific Islander Community Alliance Incorporated. Am I doing this correctly?
You are.
Thank you. Visione Compromiso, the Healthy House Within a Match Coalition, and the Hmong Cultural Center of Butte County. That's the motion. I need a first and a second.
So moved.
Thank you, Commissioner Tamplin. And a second, please.
I'll second.
Thank you, Commissioner Carnavale. So we would need to take roll now. Mariani?
Okay. Commissioner Bontrager,
Aye.
Commissioner Boyd, Commissioner Brown, Commissioner Bunch,
Aye.
Commissioner Carnavale,
Yes.
Commissioner Carrillo, Commissioner Chambers, Commissioner Chen,
Aye.
Commissioner Cortese, Commissioner Danovich, Commissioner Gordon,
Sorry, aye.
Commissioner Mitchell,
Approve.
Commissioner Rolette, Commissioner Tamplin,
Aye.
Vice Chair Alvarez,
Aye.
and Chair Madrigal-Weiss.
Aye.
The motion passes.
Excellent. So now that we have a motion and a second that the commission award the $500,000 contracts to these particular 4 local level advocacy organizations, and since we're merely confirming the identity of the organizations receiving the awards, I do not expect that we would have any comments or questions, but just in case, commissioners, are there any comments or questions? Okay, seeing none, and since this motion is merely a companion motion to the one that the commission just approved, and because we have already received public comment on this agenda item number 7, we can now proceed to a vote. We already did that. Thank you, Amirani. All right. That was our final agenda item. Thank you, everyone, for joining us today to continue the work and discussions around mental health in California. We would especially like to thank members of the public, as we always value your input. The next commission meeting will take place on September 22nd in Sacramento, and we look forward to seeing everyone next month. Today's meeting stands adjourned. Have a wonderful day. Take care.